Madam Speaker, the disastrous rollout of Obamacare has shown that those who were quick to sing its praises were not prepared to actually implement it. It quickly became apparent after the online exchanges opened that healthcare.gov was unworkable. Folks who were trying to create accounts and pick a plan who were receiving error messages being kicked off midway through the process only to be sent back to the beginning, experiencing many glitches. Madam Speaker, the administration and agencies responsible clearly were not prepared for the launch of healthcare.gov. They blamed issues with the website on an unexpected volume, which simply does not make sense. Obamacare requires all Americans to have health insurance or face a fine. There are over 313 million people in the United States, so how could they not expect a high volume? Madam Speaker, the American people are paying for a website that doesn't even work, and they're paying an outrageous amount. In her testimony before the Energy and Commerce Committee yesterday, Secretary Sebelius said that the administration has currently spent $319 million on healthcare.gov so far, and Health and Human Services has budgeted $677 million for the website through October of next year. At a time when we're over $17 trillion in debt and the government continues to borrow and spend at an unsustainable rate, this is simply unacceptable. Madam Speaker, the unworkability of this website goes beyond error messages and technical problems. It is vulnerable to security breaches as well. In late October, the Center for Medicare and Medicaid Services memo showed that administration officials were concerned that due to a lack of testing, healthcare.gov had potential high security risks, and yet they went ahead and launched the website anyways. When an individual uses the website to sign up, they enter much of their personal information, such as Social Security number and address and so forth, and many individuals who have had problems with the website may have entered it several times, and they could be a victim of fraud or identity theft if the website is not secure. Madam Speaker, it is out of concern for the security of people's personal information on healthcare.gov that I've introduced H.R. 3652, the No Identity Theft in Healthcare Act, which would increase penalties for navigators or other agency employees who commit identity theft by using information submitted for the purposes of signing up for Obamacare. Under current federal law, aggravated identity theft carries a 2-year sentence. My bill would increase the penalty to 5 years in prison for those who use your sensitive information that's been submitted for the purpose of signing up for health care. Many agency employees who have been tasked with implementing the law and processing Americans' sensitive personal information have not gone through background checks or even been thoroughly screened. My bill would deter navigators and others with access to sensitive information through Obamacare from stealing the identities of Americans who are simply trying to pick a health care plan. Madam Speaker, we need to do what we can to protect the American people from this harmful law, starting with the security of their personal information. The problems with the website do not overshadow the problems with the law itself, because the real issues with Obamacare go far beyond an unworkable website. I've heard from many of my constituents about their canceled plans, increased costs of premiums, and that they are being offered less choice about which doctors that they can see. We need to continue to work towards patient-oriented reforms and focus on protecting the American people from this harmful law. Madam Speaker, I yield back.
The gentleman from North Carolina yields back. The gentleman recognized.